We usually think of vascular dementia as a relatively uncommon cause of dementia, which is defined by dementia which results from ischemic cerebral vascular disease. But in fact, we've obtained evidence that reduced blood flow through the brain and reduced oxygenation of the tissue in the brain almost certainly contributes to most people who have dementia, particularly in the elderly. And so we're interested in measuring the contribution of reduction in blood flow. We can't use the usual markers for vascular dementia, and so we've been working on novel, predominantly biochemical ways to assess how well oxygenated the tissue is. We use a range of techniques to look not just at oxygenation, but at other aspects of vascular composition and vascular function. The one which we started off using was the ratio of one myelin protein to another. So it's been known for a long time that myelin-associated glycoprotein, one of the myelin proteins, which is present in the loop of the myelin sheath around the axon predominantly, is very sensitive to hypoxia. So under conditions of reduced oxygenation, it disappears quite quickly. Whereas there are several other myelin proteins which are much more resistant to hypoxia. And so if we measure the ratio of the susceptible protein to the resistant protein, it tells us something about oxygenation of the tissue. But there are other considerations in choosing those particular myelin proteins. So we've chosen them because they're very stable under post-mortem conditions. So if you take a bit of post-mortem brain tissue and you keep it at room temperature for up to 72 hours, there's very little change in the concentration of either of those two myelin proteins. They also have very similar half-lives. They've got half-lives of over 3 months. So if you measure the ratio of those proteins in post-mortem tissue, it's telling you about something that's going on in the brain 3 months or more prior to death. So that's the reason for choosing those particular two. We've since expanded our repertoire, so we also measure vascular endothelial growth factor A. We measure a range of markers of endothelial content, smooth muscle content, pericyte content. We measure markers of blood-brain barrier integrity, and a range of trophic factors and trophic factor receptors which are relevant to maintenance of blood vessels.